Just before my 10-minute presentation, I would like to tell you something very important, that we are switching gears here. We are moving from the literature part of the world to the dull, dark side of the science world. So be careful, forget about literature, forget about the physiological, philosophy of life. Forget about Colorado, forget about Costa Rica, and be prepared for the facts, nothing but facts. So, I'm Mohamed Kamal, I'm a lecturer of biochemistry in Faculty of Pharmacy at Shams University, and I'd like to share with you some of the data that were generated during my stay in USA under Fulbright grant. It's under the title of Role of microRNA 21 retinoic acid differentiation therapy in glioblastoma multiforme. Please let me give you a brief introduction about this work. So, what is glioblastoma multiforme? It is a brain tumor. This brain tumor is one of the most common and aggressive brain tumor, with the median survival about 14 months. 50% of the patient will die within the first year after getting this tumor, while 90% of the patients will die within 3 years. Mainly the treatment depends on the chemotherapy, mainly with temozolomide or radiotherapy or surgery. A certain population of cells that have stem-like properties were found on these tumors, and it is believed that these stem cells, which are called cancer stem cells or glioma stem cells, are responsible for the recurrence of the tumor and responsible for the resistance of the tumor to the treatment. To get more insight into the importance of cancer stem cell in the therapy, basically our conventional therapy is usually targeting the non-cancer stem cell, preserving the stem cells, and they have the ability to reinitiate the tumor, and this will end up with tumor relapse. But new modalities that targeting the cancer stem cells will lead eventually to the killing of these cancer stem cells, so the tumor cells will not be regenerated, and this will end up with tumor regression. One of these modalities that help in removing or the depletion of the cancer stem cell is through the differentiation therapy. The differentiation therapy means that I will change this cancer stem cell into more differentiated tumor cells, and by this case this will cause depletion of these cancer stem cells, which ends up with tumor regression. And to do this, one of the most important differentiating agent is the 13-cis-retinoic acid. It's now extensively under clinical trials. 133 clinical trials are using 13-cis-retinoic acid, and 5 of them are in the treatment of glioblastoma with temozolomide, which is the main chemotherapy, or Alumni. Another small molecule that is is associated with glioblastoma is microRNA 21. Briefly, microRNAs are small RNA molecules that are important for the gene expression at the mRNA levels. Interestingly, my lab, my host lab, there was a previous work where they classified the GBM according to the level of the microRNA 21 or miR21 into high miR21 GSCs and low miR21 GSCs. These two classes are distinct in their clinical characteristics, and also they are distinct in their in vitro characteristics, and of these are differentiation characteristics. So we set up an hypothesis that we think that high miR21 GSTs, when they are treated with the cis-retinoic acid, will give rise to differentiated cells and will cause depletion of these cells, as you said before. While the low GSCs, the low miR21 GSCs, upon treatment with retinoic acid, they resist this differentiation. And if we can expand this in vitro studies to the in vivo studies, usually when these cells are injected into the brains of the mice, they will give rise to tumors that more or less like the human brain tumors from where they come from. So We think that if we injected these cells into the brain tumor of the mice and then try to treat them with retinoic acid and or temozolomide, we think this will show response, while the low miR-21, because they are not differentiating, they resist differentiation with the 13-retinoic acid, most probably there will not be a response. So we set up our objectives into two questions. First, is there any difference in the differentiation outcome between the high miR-21 and low miR-21 GSTs? Okay, so, and the second one is there any difference between the retinoic acid treatment between these two? So looking at this, these GSTs, we get patient GSTs, as you can see here in the differentiation change from the neurospheres into these nutrient outgrowth cells, which are more or less like the neurons, but these ones resist this difference. And this basically was reflected in vivo, where looking at the tumors formed by the high miR-21, sorry, the high miR-21 GST, they form this infiltrative tumor, and upon treatment with the retinoic acid, this area of palisading tumor decreased a lot. Meanwhile, on the other side, then would like thank Fulbright and MD Anderson for giving me the opportunity to get this sprint. Thank you very much.